touch on the first 2 weeks, okay? So your baby has finally arrived, okay? What to expect? So in the first few days, so generally for babies who are delivered normal vaginally, basically an average stay in the newborn nursery would be about 3 days. For those of you who deliver baby by C-section, baby stays an extra day usually, so up to 4 days minimum. What to expect for the first few days? Basically, baby will get a regular check by the pediatrician from day 1, okay, all the way till baby gets discharged. There'll be some blood tests done from the cord. So this is the cord that was linking baby to mom in the womb. Some blood tests would include baby's blood group. In Singapore, we routinely check for this component in the blood cells called G6PD, which your pediatrician will explain to you. And also we will know a thyroid function. So the thyroid test is something that is routine in Singapore. Now, for those of you who have gestational diabetes, or if baby is big or small, so less than 2.5 kilos or bigger than 4 kilos, basically most doctors would ask for some sugar checks for babies just to make sure that the sugar does not dip low in the first few days of life. Now, you see that needle with that syringe there. So baby will get a vitamin K jab, okay, from the time baby is born. This basically helps to prevent bleeding. Now, in Singapore, the regular vaccinations would be BCG as well as hepatitis B. So these are the 2 vaccines that would be given to baby at birth. Now, in the next couple of days after baby is born, baby will get a hearing test. So right after the hearing test is done, you will be informed of the results of the test. For those of you whose babies do not pass the first round, so don't panic, because usually we'll schedule the repeat test again 1 or 2 days later. Okay. All right, so some questions, okay, on did you know? Okay, so colostrum is something that mommy first produces. This is the first milk. So it doesn't look like white milk that you would expect. It's actually honey colored, okay, and this precious fluid basically contains all the good nutrients that your baby needs. In the first few days of life, baby passes dark stool. So if you take a look at the diaper on the right column, basically with that darkish stool in the diaper, that's called meconium. So this is stool basically formed because baby ingests some of the amniotic fluid while baby's in the womb. So until this dark pool is cleared from the system, then baby will start to have yellow colored stool. So usually by about the 3rd day, 4th day. Now, nearly all newborns would leave the hospital weighing less than the birth weight. So babies do lose some weight after delivery, and average time for a baby to put back onto birth weight before they continue to climb is basically about a week, up to about 1.5 weeks. So besides checking baby, basically babies weight every day in the nursery as well. So you would know if baby's losing too much weight. All right, so cord care. So this is the stump that you will find on baby's belly. Initially, the first 1 to 2 days, you'll find that there's a plastic clip that is clipping that stump just above the diaper line. So that's the umbilical cord. So after you take baby home, basically you'll be given some advice about how to keep the cord dry such that it doesn't have any infection risk. Majority of this stump falls off in the 2nd week. So basically keep that area dry. What you can do is basically fold down the diaper such that the diaper doesn't cover that area, and just take extra care to basically just dab it dry such that it's not moist, okay? Now, jaundice is something that I think some of you were asking during the last talk. So jaundice is very common in newborn babies, okay? Why jaundice happens is because the liver in newborns, okay, is immature. It can't clear this yellow pigment called bilirubin fast enough. So this yellow pigment is basically from broken down red cells in baby's body. So regular feeding, frequent pooping would actually help baby clear this yellow pigment from the body. If the levels are high or is creeping up, your doctor may actually recommend that baby be placed under the blue light. So this is the blue light that you notice when you walk past the nursery during the hospital tours. You may see some babies under this blue light. So this helps to break down the yellow jaundice pigment such that baby clears it faster from the system. Okay, So how do you bond with your baby? Okay, a lot of parents ask, can my baby see me? Can my baby hear me? Okay, so make eye contact whenever you are in close distance from baby, whenever you are carrying baby. So your baby can see in black, white, and gray from birth. By about 3 months old, baby will be able to make out some colors more clearly and can focus on things less than 25 cm away. So make eye contact as much as you can, basically form a connection. A full-term baby's hearing is actually fairly well developed, so fetuses in the womb can actually respond to sound from as early as 19 weeks. Okay, so sorry daddies, but newborns have been shown to prefer their mommy's voice to others, okay? And you can play some music because babies have been said to recognize some melodies and some tunes. Okay, so some sort of tips with regards to, how to interpret baby's cry, how to know that baby is hungry. So you can see that there's this nice diagram on the right, which gives you some cues to how to interpret baby's body movements, okay, and language. So you'll find that baby starts stirring, fussing a little bit. Baby may do like a mouthing movement, so you get mouth opening, and baby will start to turn the head. So these are some early cues that may suggest that baby is starting to get hungry. Now then it goes on. If you don't feed baby, baby may have a bit more movement, a bit more fussing. Baby may start trying to put the hands to the mouth and starting to do a bit of stretching. Now, if you still don't feed baby at this stage, okay, you may find baby crying out loud, okay, baby gets a bit more agitated, okay, baby's face may turn all red. So at which stage? So basically for newborns, okay, the average interval for feeding is about 1 to 3 hourly. So if you're on breast milk, basically breast milk gets digested quicker, so baby may get hungry every 1 to 2 hours. If baby's on formula, basically baby may be able to last till 3 hours. So if baby gets all agitated, this is not the right time to feed straight away. You may need to calm baby down first before getting baby to latch onto the breast or the bottle.